Well, getting a cancer diagnosis obviously devastating, and the anxiety about treatments and procedures can be overwhelming as well.
But the disease is being detected and treated earlier, and is thanks to a new procedural technology being used for biopsies at Lexington Medical Center. Intisar Faulkner shares more in tonight's HealthU.
Sometimes things happen for a reason, and here we are telling a story about it.
I just felt comfortable with our choice, and the robotic surgery was a life changer for us.
Oh, yeah.
Steve and Mamie Turner of Blythewood have been married for 46 years. Now retired, Steve served for 32 years with the Columbia Fire Department.
Camaraderie at the fire department was, it was just a brotherhood, and I've got friends that are lifelong friends.
But Steve's new life took a turn after a doctor's visit for what he thought was a common cold.
Steve, you said you got pneumonia, but we see a little shadow area in your lung. We're just going to keep an eye on it for a while.
For almost 2 years, Steve went back for biannual CT scans while doctors monitored his lung. But during the 4th scan,
Looks like that shadow area has gotten a little density to it, and I think we need to look at it further.
the Turners wanted to get another opinion. That's when they met Chief of Cardiothoracic Surgery, Dr. Heather Currier.
I can still remember her. She called me into the waiting room, and when she reached back and closed the door with her arm, she never looked back at the door. She was just eye contact with me, and so I knew that the result was not good.
The suspicious cells found on Steve's lung were cancerous.
And I had been worried. I've lost both my parents to cancer.
But Dr. Currier had a plan, thanks to a new kind of procedural technology called ION.
He was the first patient that we did the ION biopsy on.
It's a robot that builds 3D airways using CAT scans to biopsy lung nodules from the inside out at a much smaller size.
Typically, lung cancer nodules have traditionally been biopsied from the outside in, and it's very hard to hit a small moving target. It uses the CAT scan, the material from that, to build me directions. It says, where do you want to go today? And I want to go to this nodule. The computer then builds me directions so that I can navigate down through the patient's airways directly to where the nodule is, and then holds me there so that I can do the biopsies.
The Turners felt they could trust Dr. Currier's suggestion.
We just had a good feeling. You know, when sometimes you meet people and you just get a good feeling about them and just said, let's roll with this.
That same week, Steve was admitted and taken to the operating room. After a few hours, the biopsy was successful.
We didn't have any radiation. We didn't have to do chemo. It was a great thing.
Within weeks, Steve was back enjoying the outdoors, even vacationing with his family. Dr. Currier says timing is everything, and this new technology is helping save lives.
We've done about 80 of these biopsies to date at Lexington since getting the new technology, and it's allowed us to make the diagnosis earlier.
Science and skill paired with compassion and trust.
We're just blessed that we had people looking out for us and helping us find the way.
Wow, well, Steve still says he goes to get those occasional checkups to monitor his lungs, but so far has remained cancer-free. If you are interested in learning more about the ION procedure or other cancer treatment options at Lexington Medical Center, take a look at your screen. You can visit their website or call the Cancer Center number 803-794-7511. So happy for that family.